All right, thank you for joining us today in this panel, Building the Childcare Infrastructure, State-Level Challenges. Before you move on, in the wake of the COVID-19 pandemic and the mass closure of schools and childcare centers, the childcare crisis has been brought to the forefront for families and for policymakers. But the deficiencies in childcare infrastructure have been affecting children and parents well before the pandemic. The Build Back Better Act aims to address this crisis through investing in universal pre-K by capping childcare expenses at 7% for families, 7% of their household income, and by expanding the childcare tax credit. This panel highlights the impact of the lack of access to childcare on gender and racial equity, and brings together academic researchers and childcare advocates to discuss the implications of existing policy proposals and programs to support parents across states. This panel brings together childcare advocates from conservative and liberal states to address challenges to implementing those parent-friendly policies and strategies to overcome those challenges. We'll be talking about state-by-state impacts of expanded childcare benefits, state-level challenges to quality childcare for all, and the impact of childcare supports on lifetime earnings and long-term benefits. Today, we'll hear from 4 panelists that will each bring their own perspectives to the debate. First, we'll hear from Elliot Haskell, the Program Officer in Education Policy and Research at the Robbins Foundation and author of the book Crawling Behind: America's Childcare Crisis and How to Fix It, who will set the scene of our current crisis. Next, we'll hear from Alicia Hardy, the Senior Policy Analyst at Center of Law and Social Policy, who will talk about how federal policies support individual states and promote racial equity. Then we'll hear from Shannon Jones, the President and CEO of Groundwork Ohio and former Ohio State Representative, who will share concerns of parents in Ohio and the challenges to enacting supports. Lastly, we'll hear from Rob Hockley, a microeconomist and assistant professor at the Columbia University School of Social Work, who will talk about the long-run benefits of childcare to both children and parents. Next slide. Okay. So just a few notes on the Zoom webinar today first. You can share this webinar with social media using the hashtag CareInfrastructure2022. The webinar will be recorded and made available after the event. Please put your questions for panelists, those of you that are joining us virtually, in the Q&A section by clicking the Q&A button at the bottom of the screen. For technical reasons, we won't use the chat to ask questions to the panelists. You can use the chat with fellow attendees by using the chat button at the bottom of the screen, but please introduce yourself there now. And lastly, closed captions are available for attendees on Zoom. And to turn on these closed captions, click the CC or live transcript button at the bottom of your screen. We ask that you keep all discussion in the chat respectful and follow Zoom's community standards, which prohibit abuse and hateful conduct. And we reserve the right to remove individuals from the webinar if they violate these guidelines. All right, first we'll hear from Elliot Haskell.
Great. Thank you all so much. Thank you for being here. So I'm going to talk about 3 things. I'm going to talk about the current crisis we're facing in childcare. I'm going to talk about how we got here, and I'm going to talk about what states can do in order to address the childcare crisis. So, the current crisis really in this moment shows up, I would say, in 3 main ways. And if we go to the next slide. So the first is a crippling staffing shortage. So while we all know the labor market's gone a little bit wonky thanks to COVID, the fact is that childcare is among the hardest hit industries. So even though nationally the economy has recovered to within about 2% of its pre-pandemic employment levels, childcare remains 12% below its pre-pandemic employment levels, which is the loss of about 100,000 jobs. That is a massive hit to a sector that was already struggling with staffing and struggling with capacity before COVID showed up on the scene. And we're going to talk about why in a couple of minutes. But that staffing shortage right now is sort of where conversations start and end. And it's not really getting better. The pace of recovery is extremely slow. There's every reason to believe that the staffing shortages we're experiencing are not actually a pandemic artifact, but instead an ugly new normal. If you go to the next slide. At the same time, for families, they're experiencing crisis around costs. So childcare, as we probably all know, was barely affordable. Parents are paying through the nose again before the pandemic. Childcare costs have continued to skyrocket. So even as we have national conversations about inflation, the fact is childcare costs are significantly outpacing overall inflation, and they're significantly outpacing inflation in other major family budget line items like food and housing. So childcare is becoming increasingly unaffordable. And again, that is a trend that shows no signs of slacking off, and the sign does not appear to be deeply connected to the overall inflationary factors we're seeing. And then the next slide. And the third piece of this crisis is really supply. So demand hasn't really gone anywhere, particularly as we come out on sort of what appears to be this end of the current COVID crisis. But even before the pandemic, we were seeing major supply losses. So the country had lost between 2005 and 2017 about half of its small family childcare providers, is not really making up that supply among centers. And then COVID has caused numerous closures, permanent closures of centers and family child care programs. So this is actually the rosy snapshot, because this only goes up to 2017. If we looked at it today, we would see declines across the board of the limited supply. So more and more communities are facing childcare deserts where they simply do not have slots to meet the demand. And so we go to the next slide. Why is this happening? And fundamentally, the child care is what the U.S. Treasury Department calls a market failure. And this is because we treat child care much more like a private market good that an individual relies on, like a restaurant or a gym, than like a social good where there's a significant public investment, like a public school or a library or a fire department. And that doesn't work for numerous reasons, but the economically, and I think so the other panelists will get into this, so I'm not going to get too deep into it, the fixed costs of providing childcare are extremely high because there are low child to adult ratios. So in most states, one teacher may be able to care for 4 infants, 5 or 6 toddlers. You can imagine that the fixed costs, the personnel costs go up very, very quickly. I taught 4th grade in the beginning of my career, and I had at one point upwards of 30 kids in my class. And that was probably too many kids, but the difference between a 1-to-30 ratio and a 1-to-6 ratio, when you think about the costs, is just enormous. And so even though childcare programs are charging parents a lot of money, it's actually not enough. They actually need to be charging much more if they were going to be able to pay their staff well. And that goes into why we're having the staffing shortages, because while we're seeing retail, fast food, airlines significantly raise their base compensation packages, most childcare programs have no ability to do so. They cannot keep up. And so they're falling further and further behind as a competitive industry, as a competitive place to work. And to illustrate just how little public money we have in the system, if you go to the next slide. So if you think about, public education spending in the US, and we could have better funded public schools, there's no question. The fact is that the US is lightly above average in terms of our developed nation peers. And if you hit the next, there'll be a little star that shows where the US is on that. Right, so we're slightly above average in the percentage of our GDP that we put in to public education. If you go to the next slide, though, when it comes to ECE, and then if you hit the arrow again, I'll show a star, we are way at the bottom. We are basically 3rd to last or 4th to last, depending how you want to calculate it, in terms of the percentage of GDP we put into early care and education. And this is true at the state level. So if you go to the next slide, I just picked Utah because I happen to have that data handy. This is Utah's FY 2020 budget. The advocacy group there basically added up all the money that's going into any children's services and said, like, where is that going? And as you can see, 1% is going to early childhood education, nearly 92% is going into K-12 education, and this is the case for almost every single state. So I'm not picking on Utah. You could go look at it for your own state. This is going to be the case, and there are reasons for this that go back quite a bit of history, and I think it's important that we steel ourselves in that. So a lot of the reason the US does not put money into our early care and education system, the reason states don't as well, goes back to a history of misogyny and feeling like with basically the job of mothers to be home with young children. So if you go to the next slide, a couple of quotes here. So this is from a book on childcare history, and I'm just going to read. It said reformers implied mothers who were willing to leave their children and go out to work were somehow unnatural. The famous Philadelphia pamphleteer Matthew Carey, who was actually a progressive for his day, he was supported better wages for workers. He claimed that many women wouldn't be able to do paid housework because maternal tenderness wouldn't permit them to be separated from their children. So there aren't fun quotes to read, but they are absolutely integral to understanding the history of childcare in America. If you go to the next slide, there's this one: good mother care is the surest way to produce, well-adjusted citizens. It doesn't make sense to let mothers go to work making dresses or tapping typewriters and have them pay other people to do a poor job bringing up their child. Like, that's Dr. Spock. That was in 1958. So this was not like ancient history. That was, the preeminent, parenting expert of the 20th century saying this, and fairly late in the time. And then even, recently, if you go to the next slide, this is a 2013 Pew Poll showing that 51% of Americans said that children are better off with their mother at home, just 8% saying the same. So you cannot divorce understanding small amounts of public investment in childcare with understanding that Americans have deep ambivalence about the idea of working mothers. However, regardless of that, there are working mothers, and in fact, at this point, 2/3 of all young children in this country have all of their available parents in the workforce. So childcare is not a nice to have. We can certainly support stay-at-home mothers. That should be a completely viable choice, but we have to have an external care system, or else we end up with parents suffering, children suffering, providers suffering. It doesn't work. And so we go to the next slide. What can states do? Like, how do states act? Because I know that Alicia and others are going to talk about the federal government's role in this, but what can states do? There are actually several actions states can do to shore up this failing system. The first is permanent, robust public funding. And that is, I'll beat that drum 7 days a week, because that is really the only solution here. I sometimes say that you can't think outside the box here. There isn't even a box to think outside of. So without robust permanent funding, you can't get anywhere because you can't raise compensation. So one-time funding like the American Rescue Plan Act is great, but you can't raise your compensation. You can't offer health benefits permanently with money that goes away within a year or two. So permanent, robust public funding at fairly high levels really is the only way forward. You can also fund subsidy at the true cost of quality. What I mean by that is that most states traditionally have provided for the subsidy that exists. They'll reimburse a provider at what's known as some percentage of market rate. So they'll do a survey and they'll ask all the providers, what are you charging parents? And then they'll peg the reimbursement rate at like 70% of that sort of market rate. But as we just discussed, that market rate is actually artificially depressed, right? You're charging parents less than you actually need to charge them. So therefore the reimbursement is actually an even smaller percentage of an already artificially depressed rate. It doesn't work. It doesn't give providers enough money to operate sustainably, to pay their staff well. And so a few states have started to shift to funding subsidy with the true cost of quality, where you can calculate what a programs actually need to be able to operate sustainably, to be able to pay their staff well. Along with that, wage scales for staff have been proposed in several states, where you say basically similar to public school teachers who have a salary schedule. We're going to do that for early childhood teachers as well, so that there's a baseline of a living, family sustaining wage, and as you increase your experience and your credentials, et cetera, however you want to create that system, you walk up the wage scale. So again, you sort of treating childcare workers like quasi public sector employees. More generally, it's really important that states set North Star goals. So we have had a tradition of often doing piecemeal childcare reform, instead of saying, no, like actually our goal is that within 10 years, we want no parent paying more than, 5 to 7% of their income. We want all childcare educators making at least $20 an hour. We want all of our programs to be at a certain level of quality, right? Be able to say, this is actually what we want. And here's what it's going to cost to get there. And we're going to move backwards in backwards plan from how we get from here to there. That's been happening more and more in states. And that really, in my mind, is one of the most important things. Strong local infrastructure and innovation. So our systems are very antiquated. They have been hollowed out by decades of neglect. We often treat childcare with the worst type of punitive welfare. So you have to constantly prove your your worthiness for it. If you're you can hit a benefits cliff very easily. It's very cumbersome to apply and get it in most states. And those systems don't work anymore, and they need to be updated. And so you need much more proactive systems that are there to help, which is sort of this shift in a mindset of childcare as welfare to childcare as a right. The way that we think, again, of public education as a right. Public education is actually a constitutional right in all 50 state constitutions. It is early care and education is a right in 0 state constitutions. And that is a meaningful difference in how you approach it, as I'm stated. And then the last thing here is to emphasize both the economic and the human benefits. Oftentimes you start talking about costs and people get real skittish, but the fact is that childcare, I know our panelists later are going to get into this more, so I'm not going to go into it. They actually have an enormous return on investment. They have an investment in terms of the short-term economic benefits to a state and to businesses. Then they have huge human benefits to making sure that there's child and family flourishing, which is really what we want, obviously, to have a strong society moving forward. And this last thing, I think ultimately, like the exact specifics of a solution are going to differ state to state, but having a real solution that actually fixes the structural failures as opposed to papering over with band-aids is really, that's the key difference. And if you go to my last slide, I just wanted to note that some states are starting to do this. Sorry, one more slide. There we go. So, this is over the past 12, 18 months, we've seen New Mexico did shift their way that they were doing subsidy to be closer to the cost of quality. They expanded who's eligible for it. Illinois, it's a permanent policy that if you're at or below the poverty line, you only have to pay $1 a month copay for childcare. Essentially, it's free for you. And then DC, it should be a state. DC became the first state recently, or the first jurisdiction to reach pay parity or move towards pay parity between its infant and toddler teachers and its elementary school and pre-K teachers, and that actually entails literally sending out $10,000 or $12,000 checks, to their child care workers. So we have seen some movement at the states that's really exciting, and it makes me feel hopeful for the future, because we have to leave this old failed system behind, and we have to build a new one in its place, and states are going to be absolutely key to that. So that's what I've got, and looking forward to hearing the other panelists and taking your questions after.
Thank you, Elliot. And next we'll hear from Alicia. Just 1 second while we pull up your slides. Can you just roll through them like that? Yeah. Okay. Go ahead. Sorry.
Hi, everyone. So today I'll be building on the information that Elliot shared about our current childcare system and existing gaps by talking about available federal funding states can use to support children and families with low incomes in accessing and affording childcare. I'll also talk about those funds while being a critical support for many children and families, just simply not being enough for states to fully meet and support children and family needs, as well as provider and overall childcare workforce needs. And then finally, I'll talk a little bit about major current federal proposals around childcare and how those proposals can create transformative change within our current system of subsidized care by filling gaps in affordability, sustainability, and equity. Next slide, please. And so Elliot really touched on a lot of these pieces in terms of the childcare system, the broader system being unaffordable, unsustainable. And I'd just like to go a little bit more deeply on the system being inequitable. And so these broad barriers to affordability and sustainability are exacerbated for communities with low incomes, but especially for Black, Indigenous, Hispanic, immigrant, or other communities of color that also have low incomes. This racial inequity, the racial inequity we see across systems and institutions, including employment, wages, education, healthcare, the justice system, and more, are due to historic and present systemic racism and white supremacy. But all those factors and all those institutions come together and also deeply impact the childcare and early education system. And so overall, the broad economic barriers we see within the childcare system uphold the inequitable impacts communities of color experience through these, though these experiences can look very different across individual communities of color and can be further exacerbated based on geography, gender, disability status. And so having that broad overview of what that looks like, Elliot did a great job talking about the broader childcare system. What are the currently available supports to improve affordability, create stability, and really reduce inequality? Next slide, please. So this chart shows the two largest sources of state spending from available federal funding to support children, families, and childcare providers. In the orange is funding from the Temporary Assistance Families Program, or TANF, and in the blue is funding for the Child Care Development Block Grant, which is the main source of federal funding for child care assistance to states. And so before I talk about the data in the chart, I did want to provide more context on those two funding sources. The Child Care Development Block Grant is the primary federal program that supports families with low incomes and accessing childcare, as well as supports improving childcare quality for all children. The CCDBG Act is the law that authorizes the Child Care and Development Fund and provides annual funding to states. And these funds are in the form of block grants, meaning a predetermined amount of funds annually is established at the federal level and then is distributed to states. But the block grant structure really creates a set of finite annual funds that are not necessarily adjusted based on state needs. CCDBG is a critical support for many families with low incomes, and it allows parents who would otherwise not be able to afford to do so to access childcare so they can be able to create economic stability and growth and provide for their families. And TANF is also another block grant program available to states for broad use to support families with low incomes, including through helping families afford childcare. But one of the main uses of TANF funds is through cash assistance, which gives families more broad flexibility to meet their needs as they best see fit. And so now turning the attention back to the chart, we see that in the first 10 years, states' reliance on TANF funds to support childcare spending steadily increased, as did overall CCDBG spending. However, over the next 10 years, beginning in about 2008, we see CCDBG funding beginning to decrease, with a small increase in 2011 and mostly stagnant CCDBG spending until 2019, and TANF spending remaining generally the same or flat during this time as well. And so in 2019, we did see a record spending for state CCDBG spending with a total of $13.3 billion. And you'll see that in the chart. But you also have to understand that this chart, though you see increases of funding over time or even stagnant funding over time, this chart does not account for inflation. And so what that means is that, and we've been hearing so much about inflation lately because of childcare costs, but also the broader economy. But what's so important about this is that just like $20 in 1990 would have gone much further than it would today, similarly, the $13 billion that we saw in 2019 funding, which is relatively the same amount of funding that we saw in 2007, just is not going as far today as it would have been. So this record spending that we see today really just isn't even going as far as it needs to because of over time. So as we look at the spending over time, this really paints a clearer picture of how, although spending looks fairly stable, those critical funds can do less and less each year to support children and families. And you can go to the next slide. And so this slide shows the number of children served solely through the CCDBG program. The last slide showed spending for state spending, which combined TANF and CCDBG, but this is solely children who are accessing CCDBG. And in 2006, we see a peak in the number of children served at 1.8 million. But after 2006, there's an overall downward trend in the number of children served. However, keeping in mind the previous slide and the mostly flat spending, a result of stagnant federal funding, as well as impacts of inflation from year to year, this overall downward trend in the number of children served begins to make sense. And this is because current federal investments, which heavily determine state spending, is not often sufficient enough to keep up with increasing numbers of children and families who need to access care each year, let alone to be able to keep funding the same amount of children each year. And in fact, between 2006, which is the peak year where we had 1.8 million children being served, and today, more than 373,000 children, or about 21% of children, have lost access to CCDBG during that time. We can go to the next slide. And so now I want to take a deeper dive into CCDBG to understand how children and families being served become eligible for the program, how states work with limited funding to try and implement those programs to best fit within their budgets, and how families and providers access funding. But I just want to, again, be clear that CCDBG is a program that offers a lifeline to many families, and they rely on this assistance to improve their economic stability and growth, but to also support their children's access to consistent quality care to support children's growth and development. And so, though it's listed at the bottom, I did want to talk briefly about family and provider access. Children and families receiving assistance receives a specific voucher amount to help with childcare costs. And though states have the option to waive it in certain circumstances, families are also required to contribute a co-payment based on a sliding scale according to their family income that they have to give in addition, they have to also give with the voucher that they receive. And so this voucher is paid directly to providers. But as Elliot touched on, we know that market rates really set provider rates low, and then the limited funding that states receive really creates really makes it so the vouchers don't meet enough of what the providers are already charging, which we know to be lower than what the actual cost of care is. And so in most states, providers are able to charge families so they're able to make up some of the difference in that cost between the subsidy value and what they're actually charging and the co-payment that they're paying out of pocket. And so looking more at the federal eligibility criteria, the CCDBG Act establishes a set of federal eligibility requirements. And broadly, these requirements are that children have to be under age 13, unless they have special needs, and they can be up to age 18. Parents have to be working or receiving education or some kind of job training. Family income cannot be more than 85% of the state median income. And there are also other eligibility criteria, including if a child is in foster care or receiving protective services, that allow children to automatically have access to CCDBG. And looking at state flexibilities, because states have broad flexibility to implement these criteria at the state level, often this flexibility is really used to create more restrictive state eligibility criteria to narrow down the eligible population of children and families, so states can better align their limited funding with the eligible population. But ultimately, this leaves far too many families without access to these much needed supports. And so I've listed some of these flexibilities on the slide, but there are three major flexibilities that impact eligibility. And this is that states can set income eligibility well below the federal threshold of 85% of state median income. States can also determine how to count income. And so they can choose to count receipts of other public support such as TANF or SNAP, or even child support funds that a mother or father could receive as income. And this could push families over the income eligibility threshold, making them ineligible to receive child care assistance. And states also have flexibility in determining what qualifies as education or job training, as well as how to verify those activities. And so those are three major ways where families, state restrictions or flexibilities around those eligibility criteria can really impact family eligibility. And then there's also flexibilities that don't necessarily impact eligibility, but can impact affordability, including states being able to set payment rates and establish payment practices for providers. So both of which can greatly impact provider business sustainability, childcare worker wages, and ultimately family affordability and access. And so finally, states have flexibility in how funds are invested. And while most funds, CCDBG funds must be used to support direct services, with some quality spending requirements as well, states can still choose how to invest the rest of those funds beyond those requirements. And this can impact family co-payments, this can impact provider payment rates, and also impact the available funding to support provider quality. Next slide, please. And so when we take all that together, the federal eligibility requirements, and that those eligibility requirements have flexibility at the state level. And then what we ultimately see as the number of children served, you can see through this graphic from the Assistant Secretary for Planning and Evaluation, really shows what that shrinking eligibility looks like and what hoops states have to jump through so that their eligible population is more aligned with their actual funding. But we still see that even state eligibility parameters, even those restrictions really only make it so that about 1 in 7 children, or about 14%, are actually receiving access. And so what that really means is that around 86% of eligible children are left out of accessing these much needed supports. And so I've kind of gone over this, and so I'm not going to go too much in detail here, but CCDBG is a critical support, but it often just falls short. It falls short because of decades of insufficient federal investments that just have not kept up with growing need. It falls short because it ultimately, the level of funding and the structure of funding established by the federal government is just a significant hindrance on states' ability to fully address issues with those limited funds. And insufficient funding and this rigid structure not only impacts families, but it also impacts providers and the workers that support those families. Next slide, please. And so I just want to really quickly look at what we've seen as federal funding for childcare during the pandemic. And in the 2 years that we've had in the ongoing pandemic, childcare has received more than $50 billion in emergency funding, and that's nearly the combination of the last 6 years of CCDBG funding. And such significant funding was so desperately needed so quickly because accessing and affording childcare is seen as a private responsibility, as Elliot touched on, instead of a public good. And so this framing as a private responsibility has really led to decades of insufficient federal investment in a truly fragile childcare system that was really brought to the brink of collapse during COVID, even though it was, as I just said, it was fragile before COVID as well. Next slide, please. I think I'm supposed to be on it. I'm sorry, next slide, one more slide. Thank you. Okay, so knowing that access to childcare subsidies is an essential lifeline to many families, what can be done to support this access? And a promising solution is the Birth Through 5 childcare and early learning entitlement through the Build Back Better Act. And as I'm sure many of you noticed during the president's address earlier this week, Build Back Better was just not mentioned, though the president did allude to several pieces act in terms of limiting parent expenses and capping those expenses around 7% of family income, annual income. And so I just want to take a closer look, knowing the limits of what current funding looks like, what can be done through Build Back Better to build out more flexibility for states in terms of how to be able to spend funds, to be able to better support children and families as well as providers. And so one way that Build Back Better, I'm sorry, next slide. Build Back Better really does a lot to address family affordability. It really creates an entitlement structure, and this entitlement structure makes it so that families who are in need can access funding, and instead of limited a block grant of funding driving how children and families can access care, the amount of need will instead drive funding. And so this is very critical and important. We also see a huge increase to income eligibility for families, beginning with 100% of state median income in year one, going all the way up to 250% of state median income eligibility in year 4, which is much higher than the current 85% of state median income eligibility that we currently have. It'll also reduce uncapped co-payments for families, which we all heard during the president's speech, but it'll also restrict providers from charging above those co-payment rates. And it also, and I'll talk about this, we can go to the next slide and talk about this, restricting those co-payments is fine. We can go to the next slide. Restricting those co-payments, restricting it so that providers cannot charge above those co-payments is fine because the system also creates more sustainability for providers. And it really shifts from using market rates to using a cost estimation model that will look more closely at what it truly costs providers to care for children as opposed to what parents can afford. And so this creates much more sustainability for providers. It also increases wages and provider payment rates, what I just talked about, and it reduces barriers to entry for providers by creating abundant resources so that providers can access, can be able to meet quality and safety requirements and licensing requirements under the new system as well. And one final piece in terms of Build Back Better that I want to talk about is that it really addresses equity in several ways. One of the greatest ways that it does this is through the entitlement structure. States no longer have to create restrictive requirements around eligibility, which most deeply impact communities of color due to intersecting racial and economic inequities that have been historic and ongoing. And this is something that's very important and necessary for families of color to be able to equitably access the supports under this system. It also prioritizes populations defined as underserved. And because of, again, intersecting structural and racial and socioeconomic inequities, we know that are overrepresented in these populations, which are defined as those families who have lower incomes, families and children who are receiving care during non-traditional hours, as well as dual language learners, to name a few of those populations. And so finally, equity is really addressed in how wages for providers and supports for providers and resources for providers are given through this system. And so although we don't know what the final bill and provisions will look like, what the bill will be called, if we're going to even call it Build Back Better anymore, what we do know is that it does create a significant transformative change for families to be able to access the supports that they truly need and they deserve to have access to, and knowing that childcare shouldn't be treated as a as a private responsibility, but more as a public good, because we know that it builds economic stability, that it helps children's development, and it's important for just the overall economy. And that is the last slide. And I can pass it to the next presenter.
Thank you, Alicia. That's some really great points to end on there. Next, we'll hear from Shannon Jones, and so we'll just be pulling up your slides right now.
Great. So good afternoon, everyone. Thank you for the opportunity to talk a little bit about what's happening in Ohio. I think we had some good level setting, both around state and federal policy. And so just a little bit about what's happening in Ohio. Next slide, please. One of the things that we wanted to do is to really understand what parents were telling us as they're trying to recover from the pandemic, dealing with all of the issues that have been laid out. As we're trying to advance policy in the state of Ohio, what is it that parents really need? So next slide. We invested in a statewide survey. We obviously wanted to gather the public opinion of where registered voters were. But in particular, we wanted to spend some time really understanding where parents, especially parents with young children in the state of Ohio, what their feelings were about childcare, what their experiences are about childcare. So we did a survey of 800 registered voters in the state and did an oversample of 400 of parents with children under the age of 5. Next slide, please. So here's what they told us, loud and clear, things that you already know, is that childcare is an economic issue. But what's really stunning is to what degree we were hearing from parents about how it was impacting their ability to provide for their families. I mean, 47%, so nearly 1 in 2 Ohio parents with children under 5 have said they had serious problems with childcare, resulting in them having a hard time meeting work and family responsibilities. And that also translated into 60% of either non-working or part-time working moms. So looking now not just at parents, but moms with children under the age of 5, 60% said that having access to quality childcare at a reasonable price would allow them to work more. So either get back into the workforce, as many of them were forced to leave the workforce to provide to care for their young children, but also many of them worked reduced hours. And then 43% of the working parents in Ohio had said that they had to cut back on the hours to be able to care for their children over the last few months. So clearly Ohio parents with young children were saying, I need to work, I want to work, and the lack of access to quality, affordable childcare was substantially impacting my ability to do that. Next slide. So we asked open-ended what childcare allows them or would allow them to do. And even looking at parents with childcare as well as those parents without childcare, the most frequent answer off the board was work more. In fact, we tried to create a word cloud with that, and it was so substantial, work more. It wasn't much of a word cloud, but rather a 2-word cloud. So, you know, that is intuitive, but to hear it so loudly was really eye-opening for us. Next slide. You know, notwithstanding the needs for it, there's just this general recognition that it's really costly. And so while that is, you know, more and more people are accepting that sort of this accepted fact that childcare is expensive. In this instance, 80% of Ohio voters, whether they had young children or not, say that childcare is really expensive where they live. So there is this, you know, recognition that this is a really expensive endeavor. It's too expensive. And that's laid on top of all of these parents saying that they want to work more, and it's what's keeping them from working more. Next slide. The other thing that was also really interesting about this is that 74% of all voters agree that this sort of public investment in this public good is really, really important for children. And in a variety of different measures, we tried to gauge how intense of a feeling this was. And it's true, whether it was Republicans or Democrats, or strong Republicans or more progressive Democrats, it was pretty uniformly understood that we needed to dedicate more education dollars to this youngest period of time. Next slide, please. So after understanding where what parents were telling us, we, you know, wanted to put into the public discussion as we're thinking about policy and advocacy at the state level, what providers, those who are providing the service, are saying. So in the next slide, you can see what the National Association for the Education of Young Children, the Ohio respondents were saying 76% of the child care centers are experiencing a staffing shortage. 75% of respondents identify wages as the main recruitment challenge, and it's really parroting a lot of the information that Elliot is sharing. Similarly, 68% of Ohio respondents said that low wages are the most common reason that educators have left the field. So again, we're seeing that there's this, huge need, that it's really expensive. And even though it's really expensive, there's just not ability to address the providers that are in the workforce, which is resulting in thousands and thousands of childcare teachers leaving the industry altogether. Next slide, please. So you would think then that if you have parents really telling us in a time when there are workforce shortages across the board, that they need access to quality childcare, and you have the profession telling us that that wages are keeping childcare professionals from staying in the industry, that the state legislature would respond in a way that would try to protect this vital support for families and for the workforce. Next slide, please. But here's what we really found to be what's happening in Ohio, and I suspect that it's I loved seeing the examples that Elliot shared of other states, how they've really stepped up and have invested more in this childcare sector in the 0 to 5 age range. But states like Ohio aren't really experiencing this. In fact, we're experiencing even further constriction. And so when I think about the presentation around how there has been this constraint at the federal level with CCDBG, so no real additional growth in federal dollars going to the states, then you not only is that become a state problem, but states like Ohio start to participate in the debate in ways that are actually making it worse for families and providers and the sector at large. So, what we experienced in Ohio last year, which is a budget year, is that there was a pretty dramatic and draconian attempt to eliminate the entire quality childcare system. So while still providing, quote, childcare, licensed childcare for public children, not requiring any quality standards that we have been moving towards over the better part of the last decade. That there was a lot of back and forth in the legislative process, and ultimately we took some substantial losses in the area of high quality. And while it gets super wonky really quick, I think the takeaway here is the financing of childcare is so complicated that the only way that providers can come close to getting their actual costs for providing publicly funded childcare is if they're at that high quality level. And so removing the requirement around high quality is going to have the impact of further accelerating the loss of publicly funded childcare at all. We did manage, even in losing the high quality requirement, we were able to keep in place the requirement around getting into the system, the quality system altogether, the 1-star requirements. So we have licensed childcare that that isn't necessarily in the quality system, but in order for providers to take publicly funded children, they have to be at least 1 star. So we were able to maintain that at least for a period of time. In exchange, there was a child care legislative study committee that was enacted that was to start its work last year after the budget process. Our budget was in place on July 1st and it's set to conclude and provide recommendations to the legislature at the end of this calendar year. But at the end of December, as we in the state were trying to get the ARPA allocations out the door through the legislative process, once again, the legislature came back and looked to have all of the quality requirements suspended for a year, even in the midst of while this child care study committee was ongoing. We were able to convince the governor to do a line item veto of that provision. And so the quality system is as watered down as it is, at least is intact while the child care study committee continues. All of this is just to say that there is a huge effort underway in states like Ohio that not only have they underinvested, so the state of Ohio only contributes state resources to our child care system that they're required to meet the maintenance of effort requirements of other federal block grants. And in addition, they have built up their quality system over the last decade or so by using one-time dollars. And so not only has it been substantially under-resourced, it's been under-resourced on top of a foundation that is about to have the rug pulled out from underneath it. So it's in a really precarious position. And it's one that legislators in red states like Ohio are trying to not listen to providers, not listen to experts in the field, and not listen to the parents who need it, and rather are trying to skinny it down even more. The last thing that I would say on this slide is that Ohio also happens to be one of the states with the lowest eligibility rates in the country, at 142% of federal poverty or less. So while we substantially underfund the system in Ohio, that it continues to be under attack by legislative leadership in Ohio and under-resourced in Ohio, it even on its best day isn't designed to meet the needs of so many children who could benefit and their families could benefit from that access. Next slide, please. So we continue to see how this is the newspaper articles that continue to cover how childcare remains crosshairs. The juxtaposition is, while all of the national news is talking about how we need more childcare, we need more workforce, and childcare is critical to getting workforce back to work, we have a direct assault on childcare and working families in the state. Next slide. So while childcare has become an economic issue, parents remain under incredible pressure. We know that the childcare sector is struggling. What we're experiencing in Ohio is exactly what the other panelists are talking about on the national level, and really underscoring the point that continues to be made about making investments in this work a national priority. So we really believe that parents need to be more at the forefront of this conversation And I look forward to the question and answer period. Thanks so much.
Thank you, Shannon. While we pull up Rob's slides, maybe we could answer a quick question. Shannon could answer a quick question from the Q&A because Cheryl Bergman asks if the business community in Ohio is weighing in at all due to the need to retain and attract employees. Maybe we can go ahead and just like jump in and address this real quickly before we move on.
I'd say that there's a big disconnect between the business community's understanding about the needs of their own workforce. And so we continue to work with them to get them to understand the role that childcare is playing. The good news is that more and more business leadership is beginning to understand the direct correlation between childcare and their own workforce. But really, it's not, sadly, it's not terribly obvious to a lot of the business constituencies, but that's starting to change. I mean, we're seeing even last few weeks, the Ohio Chamber of Commerce has started to weigh in. They're starting to hear from their members about the need to address this issue. The one last thing I would add is that we're also hearing, though, from our community colleges, in particular, about how childcare is really hurting, the lack of childcare is really hurting their ability to get graduates qualified for the workforce. And so we think that's another area of stakeholder leadership that will be able to be brought to this conversation.
Great, thank you, Shannon. Next, we'll hear from Rob to close out the panelists. Thank you.
Great, thank you, Georgia and Ina and all the organizers. And also, I just thought Dr. Mason started off today at that plenary session so well, really set a tone. So I get to wrap up here with a little bit of a picture of what it could look like if we had really supportive childcare assistance in our country. And in the end, I might be able to talk a little bit about conversations here in New York State. So this will be hopefully giving some idea also the long run implications. And part of that will follow up on something that Melissa Bodiak referred to when in that opening plenary session. So next, please. You can see here, I'm gonna talk about some work that reflects a lot of co-authors, and Melissa Bodiak being one. The National Women's Law Center actually worked with us on this report about lifetime earnings and savings for women. And but okay, so the overview here is a lot of co-authors. There's kind of a stream of work that we've been doing that thinks about how do we model the effects of childcare on income and poverty, especially child poverty, and then taking a broader look at this lifetime model. And then I'll kind of preview some work that we're beginning now on a benefit cost analysis. And next, please. And I'll just finish up here by acknowledging some of the funders that have supported this work. National Women's Law Center, as well as the Robin Hood Foundation for the benefit cost analysis that we're doing. Next, please. So here's the overview of these three projects. And I'll first start with the data and the main takeaways that underlie all of this research. So we're going to simulate what the impacts would look like for childcare assistance on families' labor supply. And so I really appreciate, by the way, all of the panelists that have come before, and just thinking about the word cloud with work more in big letters. Thank you for sharing that, Shannon. So we'll be estimating some of the labor supply effects, how that also affects out-of-pocket spending, and ultimately families' economic resources are going to change because of more earnings, less out-of-pocket spending, and we'll also consider the tax and transfer implications of those additional earnings too. And so I've already previewed what these projects do, but just to recap, I want to look at child poverty first. And this first project is more of kind of the short-term immediate, how does it change income and poverty for children? And then move to, what if we could look across a whole lifetime? What would that mean? And then again, wrap it up with trying to think about the benefits and costs. And as that last part is kind of newer work, I'm really looking forward to hearing from some of you, and I'll share my email. I'd love for anyone to follow up about what you think are some of the benefits or costs that maybe are a little bit beyond perhaps the framework we're thinking of. Next, please. So I'll start off here thinking about four policy proposals that were kind of recent. Two of them are more about expanding child tax credits. I was impressed with, Alicia, you were saying CCDBG as like one word. I think I do the same with CDC TCE. So, but I won't do that to you today. I'll try to leave off some of these acronyms. So the first two are expanding the child tax credits, the child independent care tax credit specifically. And then the other two are more about addressing child burden more directly, ensuring that families aren't paying over 7% of their income toward childcare, for instance. Next, please. So the main outcome, just want to reiterate that I'm going to show you on the next few graphs, will be poverty among children under age 13. And again, thinking of it in these two groups, I'll show all four of these policy proposals and our simulated poverty effects. But we're thinking about these two different ways of approaching it through the tax credit system, which Elaine Mag talked about earlier this morning as well, and also just through very generous subsidy programs. Next, please. So the first picture I want to show you is more conceptual. What if we just eliminated childcare expenses altogether? Now, I didn't mention the poverty estimates that we're doing are the supplemental poverty measure estimates. And they account for your poverty status after considering all your income, taxes and transfers, and certain costs, including childcare costs. And so we're using the current population survey and saying, if we just took away everyone's childcare cost, how much would that change child poverty? Again, focusing on children under age 13. So I want to first make this distinction of course, if you don't have out-of-pocket care expenses and we just eliminate those out-of-pocket, it's not affecting poverty in that group. And as many here may expect, a lot of families that have lower incomes, well, you see there's higher poverty rates among those not paying out of pocket for care. Some of those may be subsidized, but some of those may be relying on other types of unpaid care. But if we just eliminated all out-of-pocket expenses, you can see for those who are paying for care, it takes away a third of poverty among those children, right? It drops out, goes from 11% to 7.4%. And so you'll see that difference in this next slide as well, when you think about those broader programs of CCWF or UCCCL. Here I am with the acronyms, I'm trying. So if we go to the next slide, you'll see that that drop by 30% or 33% is approximately what you see when you look at the dark blue. So if we start off just looking at the dark blue, that's the change in poverty. And here, these are all reductions in poverty for children under 13. The dark blue is showing you the change in poverty before we think about any changes to labor supply or earnings. So this is just by reducing those who are paying out of pocket, reducing their expenses. So to the far right, the child care working families and the universal child care, those programs are coming really close to just eliminating all child care expenses altogether without any labor supply. Now, for those who are not paying out of pocket, the only way you're changing their poverty status is through increased labor supply. People entering the labor market or working more, and their earnings are going up. So I'm showing two different estimates for this. One is based on what we consider more central labor supply elasticities. I was thinking when Melissa was previewing some of the work that we did together, you got the overview from her, but if you were thinking, oh, I wish I could see more graphs and hear about more elasticities, then we can do that now. But But the more central assumptions about labor supply elasticities is what you would see, that behavioral response in that next blue, that middle blue. And then as an upper bound approach, we ask the question, what would the labor supply look like if parents of younger children worked a similar distribution of hours as parents of older children? And so there might be other reasons why they might not work as many hours as parents of older children. But if we use that as kind of an upper bound, it gives us a sense of how large the behavioral response could be. So, so from this takeaway is just one, these are substantial reductions in child poverty, period. And a good bit of it does come from labor supply effects as well. So we're seeing here around, reducing child poverty by around a third for this under 13 crowd, and possibly a bit more when you account for labor supply, especially for those large increases in earnings for those who may have been in the lower income group, not paying any out of pocket for childcare. If you want to, I won't spend much time on this next slide, but if you want to see how much the labor supply assumptions might matter, if we switch to the next, you'll see we consider a whole range of elasticities for how responsive parents might be to changes in their effective childcare price, and some of our central estimates are really relying a lot on a literature review by Taryn Morrissey at American University. And there's a range of estimates in the literature. And so if you see all these lines, our kind of conservative or central estimates are the one with the asterisks, the behavioral response, that middle blue. And you can see it's kind of in the middle or more conservative end of that cluster of estimates. Okay, so that's just kind of some of the background of what's in the model, how we're thinking about changes in labor supply, and how that affects poverty through taxes, transfers, income, and out-of-pocket cost. So the next step, and we'll go to this next slide, thank you, is to think about if we could see the whole lifetime for women in particular, how would this affect their earnings, their retirement, and their poverty status as well. And so this is a difficult question. We don't have data that look like that we can, one, just randomly assign people to these two different realities of childcare and then watch them over a whole lifetime. So we use the same type of simulation methods that we used in the prior work. But now we also create the synthetic life cycle cohort. So we basically use multiple years, and we see different people at different ages, and we construct basically what a lifetime might look like by kind of linking across people. So I won't go into. I can come back to the detail if anyone's interested, but basically we create the synthetic cohort, and one of the things that comes out of looking across a whole lifetime is we can also think about changes in wages over a lifetime, because if you miss out on a couple of years of work early on, that could change your returns to, so that we know that there's work by Spivey and others that looks at how your wages respond to time away from work, interruptions to your career. So if we could eliminate some of those interruptions to your career, you would imagine that your wages would grow. And so we build that into our models as well. So not only do we see this kind of current year effect on earnings and income, but also rising wages over time. And we try to also model what this would look like for retirement as well. So first on this next slide, I will show you some poverty estimates over the life cycle. Thank you. So this is comparing men and women, again, using the supplemental poverty measure. And first you see not a lot of differences in childhood, right? There's a growing difference around the time of leaving home and those early childbearing to higher childbearing probability years. So you see this divergence between the poverty rates between men and women. And that separation, it lasts into retirement as well. So we'll come back to this picture at the end to think about what childcare assistance, affordable childcare over the life course could mean. And by the way, for this model, we're thinking of childcare assistance where you're paying nothing if your income is below 75% of state median, and you're paying no more than 7% if you're above 150% of the state median. And everyone in between kind of phases up to that, where you're only paying 7% of income. So it's basically universally affordable childcare. So on the next slide, you'll see that we show what the income changes look like across the life course. It's kind of smaller in the early years, and then around age 34 or so, it's really when the impacts are the largest. And here I'm showing the upper bound method is this matching method, like I mentioned before. So we're considering that kind of the upper bound, and the elasticity-based method that similar to those central estimates that I showed before. That's what that bottom line is. And so in some of these graphs, I'll just, for convenience, refer to that middle estimate that Melissa referred to, around $100,000 difference in lifetime income. So, and if you look at toward the later years, the effects of childcare assistance don't go away in those later years, because you're still seeing people benefiting from those higher wage profiles, right? They're building up those higher wages from higher labor force attachment, more experience. So the next slide, you can see if we stacked up all of the benefits cumulatively over time. So that bottom level, you're seeing all of the net income, which could be earnings, it could be reduced childcare spending. And then that next level, we're showing the wage growth on its own, and then private retirement savings and Social Security savings. So you can see the full picture over a life course and into retirement. It makes quite a strong impact. And on the next slide, we can come back full circle and see what that would mean for poverty across the life course. And that first line you see when you see that drop in poverty rates is when we just look at the immediate current year. And then the shaded region shows you the amount that corresponds to changes in wage profiles, but also changes in savings in those later years. So one, it's quite a difference in women's poverty status across time, but two, it benefits all children, as you see in those early years, and by quite a lot. So let me wrap it up by showing just these last couple of slides with the benefit cost. And I'll show this mostly as a preview and as a way of requesting that you share with me things that you think we should be thinking about in terms of benefits and cost. So now another thing that we're considering is the long run future productivity of those children. But we're also doing some things to think about how cost and societal value can offset in different ways. So on this next slide, you'll see we have a conceptual table. So it's still early on for this project. We did a very similar project recently on the child tax credit, another thing Elaine Mag was talking about this morning. And we saw for the child tax credit, or for the expanded version of basically a child allowance, we would see that the benefits are about 10 to 1 to the costs. And so we're finding that there's a lot more issues to think through differently for the childcare context. But this just gives you a conceptual overview of how we're thinking about the pluses and minuses and how it corresponds to total benefits to society. And in particular, on the next slide, you'll see we're also thinking about the future outcomes for children related to higher income in the household when they're young, when they're a child. And there's an asterisk at the bottom. We're basically going to repeat that same panel you see for household income to changes in childcare quality. And that's something that's a challenge to think through. And we want to consider the implications of very young children in that first year, what it means to have childcare and be away from the mother. Overall, we see that the effects really support cognitive gains for especially children from lower economic status families. But we want to be careful in thinking about all of the trade-offs and that you might imagine for well, considering some of the big studies like evidence out of Quebec and yeah, just being careful about modeling something that's hard to really measure. But maybe we could show some of at least a lot of the sensitivity of estimates from the literature and how it would correspond to our overall estimates of benefit and costs. So if you go to the next slide and then probably just one more, because that one just says discussion. I'll end here because I'm probably at my time, I'm sure. So this is just an overview of the things I've said, but I will point out just for this last point, we are trying currently to provide some empirical feedback for discussions right now. Senator Ramos at New York State and the governor's office has been really interested in what kind of proposals that could be viable here in New York. So it's an exciting time. I think that people here are really serious about it. And again, I just want to thank the host and all the other presenters. I've enjoyed getting to be part and sharing with you, and look forward to the question and answers. So thank you.
Thank you, Rob. We're running a bit short on time here, and wanted to get some questions into the panel. The first question that I'd like to ask for the entire panel, maybe the only question I'll ask since we're running so short on time, is how can policy manage the tension between scaling up these childcare programs or subsidies and maintaining quality childcare. So a couple of the panelists talked about quality and scaling. So if anyone wants to go ahead and jump in and talk about how we can manage these two opposing forces.
Yeah, I'm happy to jump in really quickly. So I think policy can lay the groundwork for managing that tension, but implementation is really where that tension is going to be managed. Going from where we are now, providing assistance to less than 2 million, right under 2 million children, to looking at current proposals, which are estimating about 20 million children, there's just going to naturally be some tension there. But beyond funding and adequate resources, implementation is also is key to creating equitable pathways and accessing resources and supports for quality as we scale up. And so state implementation processes, including outreach, applications, and how to disseminate funding will be critical to really ensuring equitable access across provider types and access to resources for education and credentialing, to remodeling and renovations, meeting health and safety standards and other aspects of quality that we know can be unequitably distributed. That unequitable distribution will heighten tension. So I think it's a combination of policy, but also implementation and doing so equitably.
And I'd agree with that. I'd say quickly too, like, I think sometimes it's a false dichotomy. Like we're not great at actually measuring quality when it comes to childcare, but we do know there are certain inputs that are really important, right? So having stable caregivers is incredibly important. So that's a compensation thing. So if you're putting a wage scale in place, if you're funding, high wages and new compensation, that is inherently, you are raising the floor of quality. Facilities is another example. We know the physical environment matters. And so making sure that there are good kids aren't going to childcare programs and strip malls with no access to, outdoor space. Like that's important. And the thing we've learned, some international lessons, is also you have to go slower than you want to, especially when you're building a system where there isn't one. So you can't overnight say we're going to suddenly have, serve 100,000 more parents in the next 6 months, right? Like 100,000 more kids. You're gonna have quality issues if you do that. You have to set it up, and then you have to steadily do it over a number of years in order to nail it.
I would just add, Georgia, that I think that's exactly right. But I also think it is a bit of a false dichotomy in a lot of ways. I mean, when you only pay the workforce in childcare on average $10.67 an hour in the state of Ohio, and you don't pay them any benefits for it, there's really nothing quality about that when you're building a system on the backs of low wage workers, and in particular, disproportionately, almost exclusively women and women of color in particular. And so, I really think Elliot at the very beginning said that it's like, this system needs a lot of money and we should stop trying to do it on the cheap. We should stop trying to think if we just deregulate our way out of this, or we waste, fraud, and abuse our way out of this, that there's some scheme or gimmick that we can do to make this better for children and families. There is simply no substitute for investing in this public good. And it's not going to be easy. It's not a straight line. Elliot's point is well taken that, you have to be, we can't just expand without being mindful of quality, or else, the stool is going to be unbalanced. But, if we don't build the public will about this, what is going to happen over and over again is what's happening in Ohio now. We have spent 10 years building up a quality system that now is being systematically undone because we have a failure to invest in the people that make this work possible.
And I don't have the most to add to this conversation, but just quickly, the NWLC work and the estimates that we're doing here with New York State are both considering higher childcare wages as part of these reforms.
That's fantastic. Yeah, I think you brought up some really great points, but I also want to try and take a question from the in-person audience, if there are any, before we wrap up. I want to just be able to give the opportunity to anyone here who's in person, if you have a question you want to ask the panel.
Not a question, but just a comment that this has been some of the most energizing stuff I've heard all day. And I know it's a long day and people have a lot of Zoom fatigue, but I'm so thankful for all of this input and this work. And as somebody who works full time and pays more than my mortgage for childcare, I'm in a really blessed position to even be able to do that. And I know that I'm incredibly lucky. So thanks for keeping this up. It's good work.
Yeah. Well, on that note, thank you to the panelists. Thank you, Shannon, Alicia, Elliot, and Rob. Thank you to American University and to IWPR and the CareWork Network for co-sponsoring the event. And thank you to all the audience, both in person and attending virtually, for joining us today. This is a great conversation about the work very important work that still needs to be done around building our childcare infrastructure.